Hello and welcome to the City Club of Cleveland. I'm Dan Malthrop, Chief Executive here and also a proud member. Today is June 4th, here with a virtual City Club Forum. Yesterday, Cleveland City Council passed a new piece of legislation declaring racism a public health crisis. Coming on the heels of the police killing of George Floyd in Minneapolis, the legislation means that the city formally recognizes racism as a crisis that damages public health through discrimination. Cleveland follows the cities of Madison and Milwaukee, as well as Franklin County here in Ohio, and others in declaring racism a public health crisis. What this does is it triggers a process mandated by the Centers for Disease Control and Prevention that systems be put in place to remediate the health crisis. So today we'll talk with one of the authors of the legislation here in Cleveland about what this means in concrete terms. Before I introduce our speaker, I want to thank our generous members, sponsors, and donors who support these virtual forums. For a full list, you can visit us at cityclub.org/thank-you, and you can join them in supporting our work by making a contribution or becoming a member right there at cityclub.org. Now to our speaker. Councilman Blaine Griffin represents Ward 6 in the city of Cleveland. That encompasses east side neighborhoods of Fairfax, Larchmere, Little Italy, Woodland Hills, and parts of Buckeye-Shaker, University Circle, North Broadway, Slavic Village, and Union Miles. He's chairman of the Council's Health and Human Services Committee, which is the committee that generated this legislation, and he sits on 4 other committees as well. Prior to serving on council, Councilman Griffin served as executive director of the city's Community Relations Board, a position he held for 11 years. That board works to improve cross-cultural relations throughout the city and oversees police and community relations as well as youth initiatives. Now, as in every City Club forum, you can participate with your questions on this topic and really any others in the councilman's wheelhouse. Text those questions to 330-541-5794. That number is 330-541-5794. You can see it on the screen. And you can also tweet your questions at the City Club if you're a Twitter kind of person. We will work those questions in. Councilman Griffin, welcome back to the City Club. It's great to see you.
Good to see you as well, Dan.
Councilman, yesterday was a really significant day. You've been working on this legislation for a long time, and I talked to you yesterday to ask you, did you take a moment and sort of feel a sense of pride about it? And you said, no, there's no time.
There's no time. I mean, we have too much of a sense of urgency right now. And first of all, Dan, thank you for allowing me to be on the Citadel of Free Speech with the City Club. But you're right, no time is a sense of urgency. There's too much work to do to sit down and try to pat each other on the back, because this resolution is going to have to become more than words. It's going to have to be entrenched in the soul of the city of Cleveland.
Tell us about what the resolution actually means. I mean, on its face, many would worry that this is just a set of words, and we have lots of declarations. Council produces all sorts of declarations all the time to pat somebody on the back for one thing or another. But why is this more than just a set of words?
Well, for a few reasons. I often say one of my favorite movies is The Usual Suspects. And I never forget when Kaiser Soze said the best trick that the devil ever performed was to convince mankind that it didn't exist. So the first thing is just to actually acknowledge that racism does exist and that it has caused irreparable harm to a person, which in this case has been African Americans and people of color, just like our Latinx brothers and sisters as well. So what this is a first step. Like anything, you have to have a first step. And looking at it from a public health lens, looking at it from a Centers for Disease Control, public health is the science of protecting and improving the health of people, entire populations, and communities. So looking at this from a comprehensive, holistic standpoint, as opposed to just trying to fix one of the symptoms.
Can you take a step back for us and explain this is happening in many places around the country. And I think for leaders like yourself and others who are familiar with the dialogue around it, it's very straightforward. Racism causes these public health problems. But for people who may be tuning in right now, who don't see the connection, who don't understand racism as a public health threat, why is it?
Well, when you talk about 400 years of slavery, brought over here, the psychology of that and the remnants of that still exist today. The thought process, the race and social construct that system of oppression, did is still, the effects are still there. When you talk about Jim Crow laws, and then people migrated from the South to escape Jim Crow and came to the North, and then it became redlining. And in all of those areas and all of those, constructs that I just mentioned, irreparable harm has been done to the people who are still existing in those areas. If you look at the epidemiology of all of the Cleveland's neighborhoods, you'll see that those areas that were redlined have the most health problems, the most crime, the highest level of poverty, the lowest level of educational attainment. And a lot of that is because of the social constructs that racism has caused.
We should point out the City Club forums that have addressed those issues, specifically around redlining and the ways in which historic redlining has had these impacts moving forward with regard to health outcomes, as you mentioned, but also crime, police enforcement kinds of like disproportionate police enforcement kinds of outcomes, as well as poor economic outcomes, increase in poverty, and all of that. There was a forum by Richard Rothstein, who wrote the book, The Color of Law, Jason Reese, who used to run the Kirwan Institute at Ohio State University, that's done a considerable amount of research that I know informed the legislation. Councilman Griffin, what happens next now that this is a piece of legislation that's produced by City Council, signed by the mayor? What does that mean? What are the concrete steps that are about to take place?
Well, it's good that you mentioned that, because like I said, this can't be a document that just lives on paper and collects dust on the shelves. Everybody agrees that that's what it cannot be. I would tell you that anything that I've been successful at, anything that I've seen be successful in the city of Cleveland, has been from building an internal-external partnership and collaboration. And that's what happened in forming this legislation. I didn't just do it in a vacuum. Along with my colleagues, Bashir Jones and Kerry McCormick and others on council that supported it. I had the Urban League, I had the NAACP, I had YWCA, I had, First Year Cleveland. I had, several different groups that really sat there and helped us craft the language by looking at best practices so that it could be an internal and external document. And then I was happy to see yesterday that organizations like the Cleveland Clinic, university hospitals, and the Greater Cleveland Partnership and others also signed on in support just from an external standpoint. And we're getting several other requests to say, hey, we support this. We want to be at the table to do this.
So what does it mean, though? What will be the next things, the actions that come out of this that people will see?
We'll be looking at the structures that are provided by an organization called GARE, the Government Alliance on Race and Equity. We're going to look at our subject matter experts in our own backyard. I think that the work that my sister Evelyn Barnett and Mordecai, had been doing, they need to be at the table having this conversation. They help rewrite that. So we're going to look at how we put the best minds to the table. I tell people this oftentimes, that council people are asked to know a little bit about everything, but not be experts in one thing. And it's a lot of people that understand what really need to be done in order to resolve this issue of racism in our society. And we're going to bring all those partners to the table, especially the legacy civil rights organizations that I mentioned earlier.
You mentioned the Third Space Action Lab, Evelyn Burnett, Mordecai Cargill, and their colleagues there. I should mention that Mordecai is going to be on our forum tomorrow, along with Danielle Sidnor of the NAACP, to discuss the way forward and what's happening now, and everything that's been happening over the last 2 weeks with respect to the killing of George Floyd by police and other needed, other related issues. So
two very bright people, but I have to also give shout out to Marsha Maccabee and Margaret Mitchell. James, they're smart too. They got it too.
Oh, they do indeed. And I'm just mentioning that they have that Mordecai is going to be on the program tomorrow, on the forum tomorrow. Awesome. He's one of our speakers, along with Danielle Sidnor of NAACP. The legislation is obviously connected to a number of areas. From my point of view, it seems like it's deeply connected to the work that you and others and the city has been doing around lead poisoning. It's related to work around infant mortality. It's related to the immediate public health work around the disproportionate impacts of COVID-19. And it's also related to police reform and the disproportionate impact that police violence has on the Black community. I kind of want you to talk about all four of those things and wherever else you see this as having an impact as well.
Well, I think this 133rd Council has done a lot to really try to move social justice forward. And in addition to those that you mentioned, when you talk about trying to deal with lead poisoning in our city, which has been a pervasive problem for a long time, these are social justice issues. When you talk about reform and the fact of decriminalization of marijuana, which we passed, which I introduced. These are things that are social justice issues, things where we're trying to really address systems and make systemic change because they have a residual effect. So you're right. This is not just about law reform and police reform. I know that a lot of people said, hey, that's what this needs to be about. Well, we have one of the most constructive police reform documents that we're implementing right now. And what a lot of people are not talking about, with the exception or the one tragedy that we're really trying to understand now with Desmond Franklin, shootings and police involved incidents have gone down significantly in the city of Cleveland. And that's due to not just the police and the city officials, but to the community that stepped up to the table and said, this is how we want to be policed. So we do have a very strong document. We might need to tweak it, and we have to get better. And we could always look at trying to do better 21st century policing. I think we have to look at some of the rules in the union contract and other things. But I think we're in good shape right now.
The document that you refer to is the consent decree that was implemented following the police killings of Melissa Williams and Timothy Russell, as well as the police killing of Tamir Rice. Is that right? That's what you're referring to, the consent decree?
Yes.
Okay.
Yes.
That the Department of Justice has kind of pulled back on some of the pressure. I mean, they had been pushing very hard on the consent decree's implementation. And then under the Trump administration, it feels as though there's been an explicit call to just kind of slow walk some of from the Department of Justice to not press for some of the reforms that were called for. Am I misunderstanding that, or is that how?
No, you're right. I mean, you're right. I mean, for example, they just gave a grant called Operation Relentless Pursuit, and it was built all around law enforcement. Well, under the Obama administration, when the Obama administration would administer funds, it was more to focus on a holistic approach, which was prevention, reentry, and law enforcement. So even the grants that are coming from the federal government have changed significantly. However, the last I've looked, the city of Cleveland has been meeting most of the benchmarks that were set by the monitor that we put together. I take pride in it because I helped develop the consent decree. I actually sat at the table as a partner with the city to actually develop the language to make sure that the community's input was put into that document. That's why I take pride in it.
You also mentioned, I just want to circle back to the name Desmond Franklin. No, that case is not well known, partly, I suppose, because our media is in such turmoil right now and not able to cover stories in the same way that they used to be able to. But for those who don't know, can you describe what happened in that case?
Well, I don't know all of the facts in the case. It's my understanding that an off-duty police officer was involved in a police-involved shooting, and that the information that was given at the scene did not match. And we're in the process of really trying to understand as a Cleveland City Council. So that's something that, we always allow the investigation to take place. But that's something we're waiting to hear more answers on. One of the things that I try really hard not to do is give misinformation on cases like that, because once misinformation goes out there, then, it's hard to put it back.
Okay. You mentioned decriminalization of marijuana. Is that something the city council is currently considering?
We actually already passed it. We actually passed that earlier this year. We actually introduced it. and passed it, and it's law in the city of Cleveland up to 7 ounces. We had it passed 15-2. We had 2 council members that had some reservations about the amounts, but the council overwhelmingly supported that. That's why I say a lot of times people don't know the social justice issues that council has taken up to really try to address some of these systemic issues.
So do you feel that that law has been implemented appropriately by the Division of Police?
We're still waiting on statistics. Right now, I do believe it is, and some people are telling me that it is. Other people are telling me that it isn't. And at the end of the year, we're going to look at the data. As my good friend Councilman Conwell says, we're going to look at the metrics. We're going to look at the evaluation.
So I want to come back. I'm sure we'll come back to some criminal justice reform issues that are deeply connected to the public health crisis of racism. But I want to have you speak a little bit more about some things that are more kind of generally recognized or connected to health, lead poisoning, infant mortality to start, as well as maternal mortality. Can you, in what ways will the city's efforts to remediate lead poisoning and to deal with infant mortality, in what way will those efforts be different now that we've declared racism as a public health crisis?
Well, see, that's the thing. It's not always that you have to do everything different. Sometimes you have to coordinate and tie everything all together because of the one stream that runs through all of the issues that you just mentioned with criminal justice reform, housing, health disparities, and all the other issues that we have in our community, economics, which we know is very critical to all of this, is racism. The racial constructs that have been put in place in this system have been, barriers to people being able to fully participate and have healthy lives like they need to. So what's different is how do we put something in place that people can touch, see, feel, and really understand that their life is being made different. And we're going to have to do that through looking at policies. Some people sent me some things regarding platforms around immunity for police officers. Is that something that we might need to take a real deep look at, even though it has to come from the federal government? Well, then maybe we need to have advocacy at the local level. So there's several different things that we might have to look at when we're looking at these issues.
Does the public health crisis unlock additional resources from the state or the federal government to allow you to address some of these issues?
It may. That's why I said we're going to rely on the GARE document, the Government Alliance on Race and Equity, and we're going to look at some of these other cities and how their models are in place. Because I would tell you that everybody from the street club president to the president of big organizations have said, Blaine, how can I sign up? I want to be a part of this. And we're going to have to really structure this in a way so that everybody can participate, but that we also come out of it with some concrete steps. And that's why it might need to have funding. And, that's something we'll look at the right time, or we might just need to realign some of the resources that we have currently available and just have them dedicated more towards some of these things. But the mayor did say in his State of the City speech that equity is the center of how we address all of these issues moving forward. So I know that between him and this council, we definitely want to look at where we need to make investments towards equity.
So where does responsibility for implementation fall inside of City Hall? If it's a public health crisis, does it then fall to the Director of Public Health? Or is there, because this is so much broader, perhaps, and cuts across so many parts of the city's work, is there some other way in which you establish an anti-racism czar or something like that inside of City Hall? I mean, we mentioned earlier that other cities, Milwaukee, Madison, have both implemented similar legislation. How do we deal with this? How do we make sure that somebody is responsible?
Well, if it was my dream, I would like to have a chief equity officer that actually is a person that does nothing but stays focused on making sure that we have diversity in everything we do in city operations and across the board. And I think that there's departments in the city of Cleveland right now that can be redesigned, realigned, and put together to actually accomplish that. Or we might need to, do something different, maybe add a couple of other people. I will also tell you that the Chief of Public Affairs, Natoya Walker, at this time is going to lead the charge. And she's a very capable person, and she's been working in this space for a long time. She goes back to working with it when Seattle started this about 15 years ago. So I think it needs to be somebody from the mayor's office that really has the opportunity to talk and work closely with the mayor, but then I also think it's somebody that has a good understanding of all of the departments. So, you're going to have to do some investments in order to make that happen.
Councilman Griffin, you also sit on the Development Planning and Sustainability Committee of Cleveland City Council. And these issues around race and equity often get played out there in terms of how communities are developed, how resident voices are included in those development decisions and those planning decisions, and around sustainability as well, which often goes hand in hand with things like access to green space and so forth. Can you talk about how you see this new push kind of finding its way through the work of that committee?
Well, the city has already, through the Department of City Planning and Director Freddie Collier, really been working on Place Matters, and through the Vision 2020 plan in the city of Cleveland, we've had several of those kind of place matters and implemented health equity and race equity in our process. So some things have already been done. Is how do you step them up more? That's one of the reasons why there's been a big push to invest in the Thrive 105-93 corridor. That's the corridor on the east side of Cleveland that goes from Garfield Heights and East 93rd all the way to Quincy, goes down Quincy, and then from 105 all the way out to the Bracknell border. And in the center that you have Cleveland Clinic, which is the city's largest employer. But those areas have been disinvested and neglected for a long time. So working on the DPS committee and working closely with city planning, we're already trying to put plans and strategies on how we can invest in some of those distressed communities that have experienced disinvestment. And in Glenville's case, it's still recovering from some of the riotous activities that happened 50 and 60 years ago.
Mm-hmm. Councilman, with a lot of public health issues, there are very clear metrics. We're dealing with a massive pandemic right now, and we know that the metrics that we're concerned with have to do with the number of deaths, the number of identified cases, the number of tests being administered, the number of hospitalizations and ICU admits, and so forth. With lead poisoning, you can count the number of houses that have been where remediation has happened. And you can figure out the incidence of lead poisoning among children who are being tested. How will we measure progress in dealing with the crisis of the public health crisis of racism?
Well, first of all, it's a pandemic, and we'll have to create a baseline and show sort of where we are now and then where we want to be. What kind of equity and what does real equity mean? We were able to do some of that with the community benefits agreement that was orchestrated by Mayor Jackson and the trade unions a few years ago, where you actually can, get some of the private and corporate entities to adopt some of the city's policies so that you could have more people that have economic inclusion. So what we have to do is be able to, measure where we really want to be. How do we have, instead of having, more subcontractors, do we have more prime contractors that are getting projects in the city of Cleveland? How are we creating more wealth? Are we going to look at, right now, I think that the average income is about $24,000 or so for a family in the city of Cleveland. Is it, do we want to try, what is the goal that we want to try to have the average income in order to help it grow? All of those things can be measured. And like I said, there's other cities that have documents that can help us capture that data. And we'll look at best practices.
It's exciting to imagine a new kind of dashboard through which we might measure our progress that would be more than just the kind of standard things that we see about, like, whatever hundreds of millions of dollars invested in real estate development throughout the city, or the standard sort of, employment figures, which don't really take into account whether or not people are working for a living wage or not. It's a big conversation. What role do you see for residents in building that dashboard?
It's not going to work unless it has residents. And just before I, just mention that again about the residents, this whole thing, for example, in Milwaukee, this helps disaggregate data. It helps you disaggregate data faster. In Milwaukee, in those areas that have this document, they were able to collect the data faster to say, wait a minute, we have a problem with African Americans being affected with COVID-19. Therefore, they were able to redirect their resources, their messaging, and other things in order to address it in a quicker and faster manner. You get accreditation through this process that actually, can say this group is actually performing the standards that we believe in. And once again, it touches all areas. So we'll have to measure housing, measure jobs, employment, health disparities, all of those different things. Now, you asked about the neighbors and how can they be involved. And let me say this to you. A lot of times we do these type of efforts and we make them academic exercises where the people that live on East 93rd, or the people that live on Buckeye, or the people that live on Quincy in the area that I represent, don't get heard in the process. You got to just be able to lead, and it's my job to lead, and my job is to really try to make sure that their voice is heard through this process through some way in the structure. Because we can't do this without people in the community really buying into this. They really have to make sure that they feel like their voice is heard.
I'm going to transition to questions from the audience, because there's one that came in earlier that is related to what we've just been discussing. If you have a question for Councilman Griffin, you can tweet it at the City Club or text it to the number on the screen there, 330-541-5794. That's a Google Voice number we set up just to receive text messages during forums. So text your question and we'll get it. But Councilman Griffin, what about public comment during council meetings? Because you guys are all meeting virtually right now, that's all been shifted. And I've heard from others who are, you hear the talk on Twitter and so forth from people who are disappointed that they don't have a voice right now, or they don't know how to have a voice. What about public comment during council meetings?
Well, I would tell you that, the first thing that I would say to you is that I think that there is a way for people to have a voice to work closely with their council person. I think that there is a way to have your voice heard. If it were me, now I can't speak for everybody else. If it were me, I would rather speak at the committees, because the committees is where as the old political statement says, where the sausage is made, is where the policy is really debated, at the committee table. I would think that if I could, I would have more, remote health committees, to where people could actually come to a health committee that I might have remotely in the community, where people can actually come and see what we're doing on the health committee, and also give any input. I just have a thing about, when a loud minority sometimes controls the platform. When we had the consent decree, there was a small group of people that went to every meeting, and they were the only ones that spoke. So therefore, a lot of the neighborhood people got shut out. So if it was a way for a fair process so that it could be equitable on how people had a voice, I would be for something like that. But I don't see just lining people up and just having everybody make comments is how it's going to affect a lot. But I would be open to it if that's what people wanted. I wouldn't be angry at all.
Well, most council members that I know well spend an awful lot of time on the phone with their constituents, whether through text messages or phone calls or emails. And I'm sure your life, you and I know one another pretty well. I know your life is not any different than that. That's, if you and I weren't talking right now, you'd probably be taking constituent calls, which is another
Absolutely.
way you can sort of offer comment. It may not be official public comment on the record, but anyway, I got lots of thoughts about public comment and how you can do that, Blaine. You and I can speak about that offline. This question was the first question we received. How, by legal definition, can racism be a public health crisis? What legal statute applies here?
I mean, I'm not an attorney, so I'm not going to try to sit here and act like I have a legal opinion for you. I would just tell you that we worked closely with our attorneys when we did this and the other cities that we looked at to see if it could withstand a legal status, and it can. And then also a resolution is pretty much a declarative statement. So we still represent one of the most powerful institutions in the city of Cleveland, which is City Hall. So the fact that coming from an elected group of people who represent City Hall that is making a statement for an institution that is owed as City Hall, and also take the leadership role because now others across the city are starting to make that same statement, I think is huge. So I'm not so much caught up in what the legal definition of what this means is, as much as is the symbolic right now. And then the legal will come once we make the recommendations on specific ordinances and policies that we have that come out of this once we put all of the working group and all of the people together.
And I would just say that if any of your colleagues at City Hall from the law department or the media communications for City Council are listening, if they could help us out with some links to the applicable statutes on Twitter, that would be helpful, and we'll certainly share them around. This is a very direct question about the working group created by the resolution. What relationship and or involvement will that working group have with the community police, the Cleveland Community Police Commission, and their work to address the systemic racism and bias within the Cleveland Division of Police?
Oh, well, definitely, they'll probably, have a relationship with anybody working in that space of equity and inclusion. So, that's something that I think that nobody will be able to pass over. And like I said, that people would do it. We're not trying to create another system of oversight. What we're trying to do is create a system of innovation of how can we start thinking differently about equity and race in our community, not to try to find more oversight of what's already in place. I think that commission is already, operating and functioning great. And then they give us updates, and then we'll work closely with their work and just take their recommendations. We don't need to recreate what they already are doing.
Does that mean that the working group would function more as a resource to the Division of Police and to the Police Commission rather than another, as you say, layer of oversight?
Yeah. And that goes for not just the Police Commission. There's a lot of people doing great work in this space. And sometimes, like I said, it's about coordinating and bringing the connectivity together so that we could have a better impact and so that we can actually make sure that is measurable, that we actually have measurable data to show how people's lives are doing better.
Councilman, continuing on issues around police reform and the Division of Police generally, this from one of your constituents. I've been disappointed in some of the councilman's actions, such as promoting the use of gunshot detection technology and even drones. Councilman, what will you do to reduce the increasing militarization of the police and instead divert much needed funding to actually help people in our communities?
Let me say this to you. I have certain areas of this city and certain areas of the ward that I represent that people don't even call in gunshots. And the reason that they don't call in gunshots because in some cases they don't feel like they're going to get a police response. And in some cases they feel like, it's just become the norm. And sometimes technology like that helps us to be able to, police our communities in an equitable way. They're still going to have to follow all of the policies, all of the things that that we have in the consent decree and all of the training that they have. But I have areas in this city that, people are frustrated, and they're frustrated because of, the gunfire that they hear and those other kind of things. So I have to be concerned about them too. I have to be concerned about them saying every day we have to do something about these shootings and this crime and these robberies in our neighborhood. So, I'm not for the militarization of a police department, but I am for using technology and other tools in order to accomplish our mission to stop crime.
If the Cleveland Division of Police, I'm reading another question here, if the Cleveland Division of Police or the Cleveland Police Patrolmen's Association supported the resolution that racism is a public health crisis, it would go a long way that those organizations are also committed to local institutional change. As a primary bill sponsor, were those two organizations asked to support the resolution? And if so, what did they say? And if they were not asked, why not?
Not yet. I would welcome it from Mr. Fulmer or anybody in the organization. I actually happen to have a great relationship with Mr. Fulmer. And I will tell you that we would welcome that. And I agree with that person that it would go a long way if the Cleveland Police Union did support this resolution. I will tell you that it made me proud to hear the Black Shield Union, as well as retired officers like Marvin Cross, and also some retired commanders and police officers, when that horrible issue happened with, the killing of Mr. Floyd in Minnesota. It was great to see those law enforcement folks speak out. It went volumes. It meant volumes. So I think it does go a long way if we get that kind of support.
Related to this, another question that points out that the contract between the city and the Cleveland Police Patrolmen's Association is still kind of not current. It hasn't been approved. They haven't approved a new contract since March 2019, according to this listener. Would you support a language provision in the new contract that there's a mutual recognition that racism is a public health crisis?
Yeah, I would love to see something like that, to be honest with you. Yes. Why would I argue that?
That would be pretty extraordinary if that language was worked into the contract. But if you're, friendly with Fulmer, maybe you can make it happen. An elephant in this virtual room is the immense health disparities surrounding our anchor hospital institutions. How might we engage them to step up on this question of racism as a public health crisis in the same way they have so ably stepped up during the pandemic?
I would tell you that the first call that I received when we passed this resolution was Dr. Mihaljevic. And Dr. Mihaljevic said, how can the Cleveland Clinic be of help? And we want to, they've been for years, they've always been working with these issues of their relationship with the community. But just the fact that they issued a statement to state that they support this and that they want to be a part of this. We're working with Dr. Adam Myers and the Population Health Committee, and also Dr. Charles Maudlin and that whole group. And the reason that we're working with them is because we're really trying to focus on population health, not just in our ward, because I'm a council person that does not just think about the well-being of Ward 6. My concern is for everybody across the whole city. So I'm really working closely with them about how we can really try to, put a model in place to deal with the social determinants of health. And they're working closely with me to help put that together. So we're going to rely on them to help me put that side together.
Councilman, let me just see here. The questions really are almost all about the police, but I'm gonna go to this other one about marijuana, and this is a pretty straightforward question. Why is decriminalization of marijuana a social justice issue?
Because when you looked at the data, African Americans were 7 times more likely to receive a charge for marijuana possession than their white counterparts. And when that happened, then they get a record. It prevents them from being able to get school support. It prevents them from being able to qualify for certain social services, certain employment. So had a disparate impact. A lot of times you might have policies, or you might have, actions that a system is doing, or a department is doing, that has a disparate impact on a certain group, and in this case, it's African American community.
And Councilman, if you can, coming back to the police, would you speak to specifically changes you'd like to see in how the Cleveland police operate? And is there any way resources can be redirected for healing in the city rather than the way this is worded is there any way resources could be redirected for healing in the city rather than brutal police? But I think you get the gist of the questioner's point.
Well, yeah, I get the point that basically they're saying, why do you invest so much money into the police department? Why don't you
Mhm.
put more money to social services, economic development, community development, and those kind of tools? And in this kind of world, you actually have to use a balance of what you need to do. And you actually have to try to find win-wins. And one of the things that we try to accomplish with the consent decree is to have good policing that will create a safe environment, but that was institutionally and constitutionally correct. A lot of bright minds gave input to that document, internal to City Hall as well as external to City Hall. Now it's a matter of just executing and the execution of it. Um, I would look at a lot of things has to happen with the arbitrator. And while everybody is talking about how we have to fix the police department, they don't always talk about the other systems like the arbitrator, or they don't talk about the courts. In the case with the gentleman, Mr. Chauvin, who killed Mr. Floyd in Minnesota, a lot of people don't understand the law to understand that when they up the charge from a third degree, homicide to a second degree, it's going to be harder to prove that. And if it's harder to prove that because you have to prove intent, and then he winds up getting a manslaughter case because you have to go to the lesser charge and doesn't get hardly any time, then you're going to have people upset again. So sometimes really trying to make sure, that you understand the law and understand what is at risk when you're looking at these different systems and policies.
Councilman Griffin, there's an organization called Campaign Zero that has a list of 8 reforms that they say cannot wait, and they have a pretty extensive list of ways in which in ways in which police reform should be implemented. They have a strong advocacy agenda. Many of these sorts of things are things that the city of Cleveland, I think, has already implemented. Banning chokeholds and strangleholds, requiring de-escalation, warnings before shooting, duty to intervene, banning shooting at moving vehicles, establish a sort of use of force continuum. 2 that the city has not yet implemented, exhausting all alternatives before shooting and requiring all force to be reported. Are those agenda items that you'd advocate for?
Many of them are already in the consent decree, but many of them I would like to hear the details and see what many of the details are. I would tell you that, one of the things that I can remember vividly when we were having conversations around the consent decree was the use of force and when do you call it a use of force. And there was a lot of debate around if it was when you unholster your gun or when you have a force multiplier and all these different things that we looked at. So a lot of those issues were looked at, and the Justice Department, I think, did a great job under former Attorney General Steve Dettelbach of really, guiding that conversation. I could remember vividly that the best practices kind of won out of how you have to have that de-escalation. I think one other thing that is important when I look at some of these platforms is how do we have mental health professionals with a lot of these police officers and embedded in the police departments as well. When I go to other cities like Boston and other folks, they have some of their social services and mental health services embedded in the police department because police officers oftentimes get called to be social workers too.
They do. Absolutely. I want to switch gears a little bit from the police to some of the other areas in which you work. We talked about development planning and sustainability. You also serve on the finance committee. And so moving away from the public health crisis conversation for a second, COVID is going to have an extraordinary impact on the city's finances. And what are you seeing, and what do you think the solutions are? This is not a 12-month problem, but probably a multi-year problem that you're facing.
Well, it's definitely going to have a huge impact. We're not panicking yet. The reason why we're not panicking is because one of the things that I think that I have to give Mayor Jackson and Sharon Dumas credit for is that we really worked as a council to pass a budget that was that had a that had a rainy day fund, that we had some surplus. So we prepared for a recession. We didn't know the recession was going to come in the first quarter, but we prepared for it. We're going to wind up taking a huge hit, probably for the month of April. Those numbers are probably just now coming out. March was just about what we anticipated when we got the last report from Director Dumas, Chief Dumas. But I think April and May are going to be tough hits, and we're going to probably have to cover some of those gaps with, probably some of the money that we plan for the recession at a later time. But we do believe, because the biggest employers are employers that basically are starting to come back to work, like at the hospitals and some of the other locations. So we should recover, but we are going to have a problem for the next few years.
Do you see the solutions for those problems? Is that a reduced workforce? What are you thinking about?
Right now, I don't see a reduced workforce. I see that we may have to probably provide less services in a couple of areas or something like that. And I don't think we're at that point yet where we have to reduce services or lay off people. But it is something that we're going to have to examine at the right time. But right now, it looks like we're in pretty good shape.
Councilman Griffin, speaking of workforce, though, you also serve on the workforce committee. Unemployment levels are at historic highs right now throughout the city of Cleveland and surrounding communities as well. I've spoken to folks at various hospitality employers, large hospitality employers, where they've had to lay off as many as 90% of their employees in response to the business basically drying up in the hospitality industry. What kinds of plans is the committee discussing to get people back to jobs? And if you'll allow me just a second here, at the beginning of the crisis, it felt like there was a moment when people were thinking, wow, we've hit pause on the economy. What if when we came back, we could rebuild the economy in ways that were more just, more equitable, creating more access to opportunity for more people? In the city of Cleveland, that seems like connecting people to the jobs that are available, connecting people to the training to get into those high-skilled, better-paid jobs. What's council talking about? What are you talking about at the committee level that you hope to implement?
Well, one of the things that I think that I want to give credit to my colleagues, Councilman Carey and Councilman McCormick, is to try to look at how we do innovative and different things. Like we voted to look at how we can expand patio and parking lot access for restaurants and venues to be able to have more outdoor dining and other things like that. We have a large service economy. So what we really have to do is try to find innovative ways to jumpstart our service economy. I actually had a Zoom call with all of the, a large amount of the business owners in Little Italy. And we talked about, the tools that the city's trying to do and how we're trying to find ways to support small business owners and mid-sized business owners. So we have to try to find ways to attract, people back to the service industry and work with groups like Destination Cleveland and now that people are probably not doing vacations and going down to Disney World or wherever else anybody goes, how do we try to focus on, hey, do a staycation, really promote going to the local establishments and having different things that we support there. So we got to find a way to support the, small businesses in the city of Cleveland.
It seems like that's really a place where planning and where planning and public health and economic development all come into play. There are cities nearby here that are opening streets to pedestrians, which on the other side of the coin is closing them to cars, so that you can create social distance dining areas where, that are essentially pedestrian areas. And, your neighborhood, the neighborhood you just referenced, Little Italy, and the neighborhood where you live, Larchmere, I mean, these are places that do that at least once a year. And we know that it's successful. We know it's doable. Are there real conversations happening at City Council about making that possible, creating new zoning ordinances to allow for neighborhoods to do that?
Yeah, we actually, like I said yesterday, we had a conversation about it, and as I said before, Councilman McCormick and Councilman Zone really, because they have a large, base of those kind of restaurants, really, had that discussion and council passed that. So now we're looking at how we can actually start to implement that because we have to attract people back to these different areas. A lot of folks are. A lot of folks are not traveling out of town this year. A lot of folks are not going to other places. We have to try to make people rediscover Cleveland. How do they rediscover Collinwood? How do they rediscover Fairfax? How do they rediscover all of the different jewels that we have in Cleveland? And I think that that's going to be all of our jobs to become ambassadors to make that happen.
Your colleague, Council President Kevin Kelly, said in this question, you briefly mentioned lead poisoning, but can you talk more about the relationship between lead poisoning, infant mortality, and COVID-19, and the racial implications of the health outcomes there, and how this racism as a public health crisis declaration supports efforts there?
Well, I mean, when you got 4 babies, with African American women, are 4 times likely to lose their child than their white counterparts. When you have African American children that have higher rates of elevated blood level, lead levels, when you have all of these different things that we fall behind in the data and statistics, but a lot of us, like myself, don't need data or statistics. Sometimes when I look at a lot of this health data, I say, thank God, because I fall into a lot of these different categories that they fit. Being raised as a young man in the city of Cleveland, and also raising a family in the city of Cleveland. We really have to look at the data, but at the end of the day, Dan, I just got to tell you, people really want to touch, see, feel, and see change. We could talk about the data and make the case on data as much as we want, but people want to see and feel the better quality of life in the city of Cleveland, and that's what we have to work for.
Well, gets to the other question that came from Kevin Kelly, but from another listener. What does this actually mean for Black people? And what does this mean for the systems that you work on?
You broke up a little bit, but if I heard you correctly, it said, what does this mean for Black people? We are trying. What does this mean for Black people? It means that we are going to push and that we are going to demand change in every system across the board. This means that we want to make a system that is more equitable for Black folks. We want to shorten the life expectancy disparity between somebody who lives in Woodland Hills, who has almost a 16 to 17 year difference in life expectancy than their counterpart who lives in Lyndhurst. We want to see the real change. We want to see better housing. And it's going to be hard work, but I think we're up to it as a city.
Councilman Blaine Griffin, next year, 2021, there will be a race for the mayor's office. What kind of leader do you think the city needs in 2021?
I think the city is going to need a leader that is visionary. I think that people will follow leadership. I think somebody's going to have to think out of the box. I think that you have to be a little bit old school, but you also have to be very new school. We have to embrace technology. They have to become a smart city. It's going to have to be someone who really understands how we can make technology happen. Someone who can bring traded sector jobs that have gone overseas back to our area, to the city of Cleveland. And it's going to have to be somebody who can build a collaboration and build a network of people that all want to work in the same direction. One person is not going to make this city move. So that leader is going to have to be able to motivate all sectors of our city to really make Cleveland the city that we should be.
Will you be running?
Well, right now it's premature to talk about running. We have a mayor. We have Frank G. Jackson, who is the mayor of the city of Cleveland, and great people of Ward 6 elected me to make sure that I get this grass cut, that I make sure that these streets are fixed today, and that I make sure that I let them know the bulk pickup. But let me say this in all seriousness and honesty. I love this city, and boy, how great it would be if, for whoever to have the honor to be the leader of this city in the future. So just to even think about how, to serve the people of the great city of Cleveland, it just gives everybody goosebumps.
Well, that's definitely not a no, Councilman. I appreciate your candor.
Thank you.
Well, Councilman, we're going to leave it there. Councilman Blaine Griffin represents Ward 6. And Councilman, we really appreciate your time. Congratulations on getting that legislation passed. I know you haven't had a minute to really enjoy the success of that, but I hope you will recognize that it is a big success. I have received emails and text messages from people around the country who are noticing that this has happened. So congratulations to you and your colleagues on City Council and to the city. And the City Club is here to help with the necessary conversations as we try and figure out what this actually means. So I hope we'll stay in touch.
Thank you so much. Appreciate it, Dan.
Okay. I want to thank all of you as well for joining us. Our virtual forums are sponsored by the Cleveland Foundation, George Gund Foundation, KeyBank Nordson, the Northeast Ohio Regional Sewer District, and PNC, as well as many more generous member sponsors and donors that you can find on our website at cityclub.org/thank you. You can join them in supporting our work when you make a contribution online, or you become a member at cityclub.org. And we're going to continue to present our forums virtually, as either here on platforms like this or through IdeaStream. You can join us tomorrow at 12:30 p.m. as Mordecai Cargill of Third Space Action Lab and Danielle Sidnor of the Cleveland branch of the NAACP join us to discuss last week's protests and whether we as a city are ready to confront racism. If you have other ideas about topics or speakers we should feature while we're sheltering in place and figuring out the new reality.
All right.